And so, tell me what you do now and how you carved your path to your current
Yes.
situation.
So pretty much over the years, remember what I was trying to do is I'm trying to find, first of all, when I discovered when I was in my anesthesiology training, when I was hitting a year, it made me feel that I was in the wrong place. I why did I get into medical school in the first place? I just want to get to that. In the Philippines, my mom, I remember growing up. I think this is her dream, to be a physician herself, but she didn't get to be one, and so she. She told me, she convinced me that, if you become a doctor in our country, you will literally never go hungry because people will appreciate you and they will actually, you may not get paid, but they will bring you like, and I saw this, people bring vegetables or some of their chickens, from their farm and they give it to doctors. Okay, this makes sense, but then my life has changed because I moved to the United States. So I started to think, what am I going to do here? Because first of all, do I go back to being a doctor when before I even left, I was so stressed. And could I go back to anesthesiology? And if I do something else, what was it that I didn't like? And I remembered, yeah, you see a lot of patients, you try to help them, but if they're not compliant, that really makes me feel like my work is for nothing. Like you educate them about the medications that they should take. They get worse anyway because they're not going to follow. So, and plus the fact I started to understand about myself. What are my gifts? What are my talents? And what am I passionate about? Those I believe are very, very important. So I look at myself. Who am I? Why did I get so stressed in anesthesiology? First of all, I was only in the OR area. I love to go out. I love to be meeting a lot of people, and that doesn't happen when you're in the OR all the time. So um, maybe that's what I'm not supposed to do. And so as I try to understand who I am, but there's only one thing that I know is that I will never do that again. I will never go into a place wherein I couldn't bring with me the previous skills that I already accumulated. Otherwise, it's going to be um, a waste of time. And that's not going to happen anymore. And that's why I went to this school. And also at that time, that was 2008 to 2010 when I did that. And at that time, you would hear it was President Obama when he was running for office. He talked about the Obamacare. And I had a feeling that the database is going to be important. And I said, by 2014, I should be an expert in this field. And recruiters should be calling me because they need a consultant, those kind of sort of stuff. I realized that I'm not going to be in the clinical, but I will be in the backgrounds. I will understand how the hospital, the business of, uh, of, of the private practices, understand how a hospital works, how they charge, how they make the money, and all that. So I thought I should do that. And I learned also that the resume, what they use for applying the job, has to tell a story. So I couldn't just be applying a job here and there. It has to tell a story where I started and where I moved. What else? It will tell the people looking for the hiring people about the skills that you accumulated when you were there. So my resume is just 1 to 2 years. For some, they don't like it because they think that, oh, you can't even stay long in a job. Well, for me, I learned already how it works in a year. So after a year, if I put an application, it will take, as I go up uh, with the position, um, it will give me time. So it's almost about 2 years, and then I get another job. So the next job after the the data integrity is another one, but I got back to a regular hospital and I did the same until I finished.